Hello everyone and welcome to today's webinar. We will be starting momentarily, so just give us a few more minutes and we'll be starting very soon. Hello everyone and thank you so much for joining us. We're giving just another minute or two here for people to join us and we'll be starting very soon. Hello everyone and welcome to our August Model Aquatic Health Code Network webinar. It is a pleasure to be here. In today's webinar, we'll be discussing about ensuring aquatic health and safety, updating the Model Aquatic Health Code. Before we begin, we just have a few logistics to go over. So you can listen to this webinar via your computer speakers, or you can use our conference line that is listed here. Because of the number of participants, everyone is in listen-only mode, but you are welcome to submit comments and questions via our Q&A box at any point during this session. Our speakers will be addressing your questions at the end of their presentation, and we'll have plenty of time for Q&A then. Finally, this webinar is being recorded and we will distribute the recording to all participants, and you can always access it in our MAHC network webpage. So if you're not familiar, this is our website if you want to learn more, or if you want to join our Model Aquatic Health Code network. Every time we hold our quarterly webinars or any other events, you will receive a newsletter announcement. So if you want to sign up, please visit our webpage. And if you have any questions, please feel free to contact us at macnet@nature.org. We also wanted to remind you that next week, NATU is holding its 2020 Preparedness Summit. It's going to be a virtual conference this year. Registration is already open. We have several sessions, great town halls and plenaries, which will be live, and also sessions on demand. And if you register for the conference, you have access to all the presentations for up to 1 year after the conference. So it's a great opportunity to get to know other colleagues working in this area. So we definitely encourage you to check the website and register. So with that, today we are joined by two wonderful speakers from the Council of the Model Aquatic Health Code, Christy Reister, the Executive Director, and Dewey Case, the Technical Director. So without further ado, I will pass the floor to Christy and Dewey, and then we'll get started. So thank you so much for joining us today. Christy, you might be muted.
Thank you for reminding me.
No problem.
So welcome everybody. Thank you for joining us. As Daisy mentioned, we are going to be talking about ensuring aquatic health and safety, and through our update process that we do to the MAHC every 3 years. Again, it's myself, Christy Reister, and Dewey Case. And if you could go to the next slide, please. So my name's Christy Reister. I joined the team in June of 2019. So I've been with the CMAHC for a little over a year. I have 20 years of experience in public service, starting as a lifeguard and working my way up to Community Services Director before joining the CMAHC team. I am very passionate about aquatics. You can see here my husband Troy and our daughter Jillian. My husband and I actually met on the pool deck coaching swimming together. And we live in the Phoenix, Arizona area. I really love working with organizations and groups and help people achieve their goals. And of course, love my family. Next, please.
So I'm Dewey Case. I'm the technical director. I've been with CMAHC since January of this year. I've got over 20 years experience, full-time aquatics experience, and mainly in aquatic management, and probably another decade of that paraprofessionally, part-time lifeguard, part-time pool operator, etc. In addition to my role with CMAHC, I'm also an active operator, managing indoor aquatic facilities for the YMCA in my area. My main role with CMAHC consists of working as with the MAHC update process, leading the TRC, as well as just being a technical expert and providing a resource for the industry. Next slide. So today, as we talk about the update process, I do want to first brag on our TRC, our Technical Review Committee. This has been a very, very interesting year, pandemic aside, but also with a number of CRs. There's too many names to list here, but every member of our TRC is very passionate, very well known, are knowledgeable in their fields. And it's been a total pleasure to work with them, as well as our TSC's, Technical Support Committees. So when we started the CR review process, I actually have to go back a little bit before this. We opened up the change request submission period back in around June of 2019 and provided the 6-month period to where anyone can submit change requests. So in January 2020, we formed the TRC, Technical Review Committee, and the TSC, Technical Support Committees, and began getting them engaged. Our TRC and TSCs come from our membership. So we have our industry that is working with us to help update this thing called the MAHC. On the TRC, it's important to note that it's composed of approximately half public health, with the other half being industry and academia. And I think I have a little bit better breakdown a little bit later in the slide set. In March of this year, we started reviewing the change request process via phone calls. We immediately had to switch gears because of the pandemic. Obviously, things exploded pandemic-wise around that time frame. So we had to go on a slight hiatus. And as we regrouped and as our public health members focused on pandemic response. I'm proud to say that as of Friday the 14th, we have completed the initial TRC review, and shortly we'll be opening for the second round of public comments. So look for a notification coming end of this week, first of next week, that that's open. Next slide, please. So going back to the TRC, just to be a little bit more specific, the TRC had 13 members this year. 6 are from public health. We have 2 from academia, and then 5 from various aquatics industry sectors, whether it be manufacturing or operations. It's very important for us that when we look at composing the TRC, that we find a representation of all industries. But of course, the MAC being public health focused, we want a solid majority of that coming from public health and the regulatory aspect. From the TSC, we had 6 TSC forms with 16 members from various segments of the aquatic industry, and all of these represent the brightest minds in aquatics today. Next slide, please. Okay. So there's a couple of things that the TRC has been doing. One is we've had 2 consent agendas. The consent agenda are change requests that were considered editorial in nature and needed minimal review. So we were able to have 2 of those that can knock out a number of CRs very quickly. And we also have our email agendas. So email agendas, again, these were mainly CRs that the TRC felt needed minimal discussion. And we would send out an email agenda with a listing of CRs. We would have this email discussion over those with a vote approximately 1 week later. We had 11 email agendas with an average number of 25 change requests covered per agenda. And then finally, on our TRC calls, our calls are items that we considered substantive, that we felt needed more discussion than was feasible via email. And also, at any point, any TRC member could pull a CR from either the consent agenda or email agenda if they felt it needed additional discussion. It is noted that there were 14 calls, and we spent approximately 40 hours of combined call time discussing these CRs. To highlight the scope of work, we had 530 CRs submitted. Next slide, please. So again, you know, how big was this? This was a definitely monumental task and Herculean task by the TRC. As I mentioned earlier, we had 530 change requests submitted for this edition. This is in stark contrast to the 3rd edition, where we had 160 different change requests. As part of the TRC review process, each CR was assigned a champion, and each individual champion which was a TRC member, had approximately 30 to 40 change requests that they had to review and bring to the table for deliberations. There were a certain number of CRs, those that come from the CMAC ad hoc committees, and that would have been the surf lagoons, the swimming lagoons, the surf venues, cyanuric ad hoc, interactive water play features, where those were not necessarily assigned a CR champion originally. We did go back later on and assign a champion to review those, but with those coming from our committees, those were considered pre-vetted for discussion. Now, of these change requests, about, and this is just a rough number, about 80% are non-substantive. So examples of non-substantive change requests could be modification of definitions, consistency issues where we were normalizing phrasing like barriers and enclosures, and also CRs that the TRC would quickly identify as no. either because of logistics, because of operational expense, because they were revolutionary in nature, or because they favored one product specifically. So definitely a lot of work. And here's the really interesting thing about our process, and where our process, I think, is very, very strong. Each CR gets the same attention. So even though we had this massive amount of CRs, each one was given all due attention and was very much considered. Even with the consent agendas, there was a lot of deliberation going on between what should be on those consent agendas and what shouldn't. So I'm really proud of our process, and I'm really proud of our TRC that worked very diligently to get through this task. Next slide, please. So what's up next, right? So around August 20th, we're going to be opening for the second round of public comments. This will give us about 60 days before we have our Vote in the Code conference. On October 20th, roughly, the second round of comments will be closed ahead of our conference that Christy will talk about momentarily. And then on November 16th, which is 3 weeks after our conference, the 30-day voting period opens for CMAC members to provide their input on whether or not the MAHC should be modified accordingly per each individual CR. Next slide, please. So some things to keep in mind, right? All the TRC votes are just simply recommendations. CMAC members are always welcome to vote their conscience on any given CR, even if it does go against the vote recommendation of the TRC. And this is an important part of our process, because each individual person, whether they be from public health, whether they be from operations and management, design, construction, service sectors, whether they be from the manufacturing sector, everyone has a say. You just have to be a CMAC member to vote. The second comment period is used for any CMAC members to influence how votes are, not necessarily to change a CR. And that's important to note. Although these comments can end up influencing later on. But for example, with the first round of public comment, the TRC was using those to influence how they voted on any particular CR. At this point, the second comment period is more intended for individuals to lobby, quote unquote, for a particular vote. At the Vote the Code conference, we'll also have caucusing. Caucusing is when we break down into various sectors. And again, this public health would be a sector. The design and construction and service would be a sector. And then these sectors can work together to identify a common way to vote on any particular CR. There is one more opportunity for changes. So although the opportunity to modify a CR has ended based on Friday with the completion of the TRC initial review, there is an opportunity as we go through the Vote the Code conference to where a submitter can modify a CR based on conference feedback. The difference is here, the TRC is not going to be able to actively modify a CR or improve a CR like we can in the CR review process. But submitters are free to modify their change request. Now, one thing to note is after the conference, if any submitter modifies their CR based on conference feedback, then the TRC does have to reconvene to review that particular CR. I do want to pause here and just talk about transparency for a moment. One thing that is very key for us is trying to be as transparent as possible. So to do that, obviously we have our TRC calls that are made public for our members and stakeholders. We also are uploading each recording of the TRC calls onto cmac.org. We're also uploading summaries of each call to where you can read, not necessarily a transcript, but just a summary produced by our TRC chair. And we're also uploading summaries of all of our email agendas and consent agendas. So we're really trying hard to make this as transparent as possible to where our CMAC members in the industry can be as aware and informed of what's going on with the review process as possible. Next slide, please. So there are some hot topics that we addressed. One is work coming from the CMAC Cyanuric Acid Ad Hoc Committee. This committee has been working for approximately 4 years now. They've produced one scientific paper. But out of this committee work, a couple of things that are high profile that are being recommended is a 30-to-1 cyanuric acid to chlorine operational ratio. They've also added a definition of DPD-FC to identify the chlorine level as tested in the hand test, right? So again, they're recommending a 30-to-1 operational ratio. They're recommending that higher levels than 90 part per million cyanuric acid be allowed, provided that the operator can test properly, either through the dilution method or electronic testing. And then also an imminent health hazard closures for ratios exceeding 45-to-1 or exceeding 300 part per million cyanuric acid. These were put together from this group, and I have to say the Cyanuric Acid Ad Hoc Committee is probably one of the most knowledgeable groups that I have had the pleasure of working with. It was really definitely interesting and a pleasure and an honor to sit in on some of their calls. The TRC did vote yes to recommend these votes, so now it goes to our membership for a final decision from membership. Next slide, please. Additional hot topics include the Artificial Swimming Lagoon and Surf Venue Ad Hoc Committees. These were two separate committees. These were formed last year to address the growth of these two particular venues in the aquatic sector. These venues involve large bodies of water, and they're definitely non-traditional swimming venues or aquatic venues. The committees will continue their work over the coming year. The TRC did not recommend a yes vote on these CRs, feeling that there was additional work that needed to be done to clarify and refine these CRs. So pending the vote on the code conference, these committees will continue their work over the coming year or so with the goal of releasing guidelines from CDC. And then we would look at creating change requests to include those in the 5th edition of the MAC. Next slide, please. Other hot topics that the TRC covered was discussion of modifying acceptable ranges of pH from down to a low of 7.0 and as high as 8.3. Lowering the maximum free chlorine level allowed to 5 part per million, and then various air handling CRs that came out of our Indoor Air Quality Ad Hoc Committee. We also had significant discussion on whether or not the MAC should reference other codes inside the MAC itself. Next slide, please. And with that, I'm going to turn it over to Christy.
All right, thanks, Dewey. So our, as Dewey mentioned, our vote on the code is coming up, and we are going virtual this year, as are a lot of people that typically host a conference live. So we're actually really looking forward to the opportunity to hopefully have as many people attend as possible, since we're making it very reasonable. As I mentioned earlier, we do the vote on the code takes place every 3 years. So we update the MAC every 3 years, going through the process Dewey had already mentioned. Our conference this year is going to be October 21st through the 23rd. And we're spreading it over 3 days instead of usually doing it the 2 days, because we figured since it's virtual, people don't really want to be on the computer all day long. So we're going to break it up a little bit to make it a little bit easier and more flexible for schedules. Participants will still be able to safely contribute to live discussion and debates from their own computers. We will be having the caucusing room, so you'll still get those breakout sessions. It'll be as close to being in person as possible, with hopefully some more participation since we won't have to travel. Next slide, please. So we are making it super accessible for our members. It is free. So please register today if you're not already a member, because it will be $100 for non-members. So we're hoping that this will encourage people to become a member and see the value in that. We are working really hard behind the scenes to increase and add value to your membership by providing educational opportunities and all sorts of good stuff. You will hear live presentations. You're going to receive an electronic and hard copy of detailed Vote on the Code guidebook. This is going to make it really easy for you to be able to follow along and see what changes are being proposed. We're making it's a beautiful guide, and it'll make it really easy. Attendees will also receive some fun swag and some really great things. So we're really excited. You'll hear live presentations about the MAHC, the change requests, member comments, and the TRC recommendations. You'll be able to participate in the caucus discussions. You'll have an opportunity to network virtually with your fellow CMAC members. We'll have opportunities and get-togethers to network throughout the conference as well. And you'll learn about the CMAC successes and future priorities. So we'll really hope that you'll join us. There's going to be a lot of great stuff, a lot of things that are included for free as a member. So we hope you'll join. We are running a membership special right now. So typically, if you aren't already a member, it costs $160 to sign up through the end of this vote on the code. But if you sign up today, we're offering for an additional $30. Your membership will be good through the next vote on the code through 2023. So it's a really great deal if you aren't already a member. We hope that you will join us and become one today. Next slide, please. So with that, I don't know if anybody has any questions. If there's anything in the, please put it in the Q&A. And we are happy to answer any questions that you might have about the vote on the code, the upcoming conference, the change requests, any of the hot topics Dewey talked about. So please feel free to submit any questions. Our contact information is up here on the screen as well. If you want to send us a message or give us a call, we would love to hear from you.
Thank you so much, Christy and Dewey. We really appreciate such an informative presentation. Just to remind everyone, you can submit questions via our Q&A box, or you can submit comments too, and we'd love to hear from you. So we'll give another minute or two for you to send us your questions. In the meantime, I will open up to see if any of my colleagues here on the call have any questions they would like to pose to our panelists. Okay, so we have a
Daisy, I do have one correction while we wait to hear from other responders. I was just reminded by one of the TRC members that the TRC did vote to abstain on the 90 part per million increase in the operational max. Now, one thing about abstain simply means that the TRC was unable to reach consensus on that CR. So some agreed and some disagreed.
Sounds great. Thank you so much, Dewey. And thank you, Alan, for joining us. and for your comment. Okay, so we have one question here from Colleen. Thank you for the presentation. I know it is totally unrelated to information provided, but was there any COVID discussions with the committee? Anything to share?
This is Joe Lako from CDC. The TRC, the Technical Review Committee, really focused on the change requests that were submitted to the CMAC. As far as COVID and aquatic activities, CDC was very involved with putting together guidance for both regulated venues like swimming pools, water parks and such, as well as unregulated beaches and natural bodies of water. And that guidance was put out in the spring. So I would advise you or direct you over to CDC's website. Right at the very top is a big banner for the COVID, and there's lots of guidance documents within, including stuff on recreational water as it relates to COVID. And I think we already had a webinar on that, I want to say back in May or so.
We did, and you can find that. Thanks, Joe. Yeah, we did, and you can find that. There's a link to that on the CMAC website as well. I know a lot of people have been asking about COVID-19 and how it will be, if it will be represented in the update. And unfortunately, all the, as Dewey mentioned, we are very transparent with our process, and the change request process was closed before things with COVID got, I don't know, out of control, I guess is probably the best word. So we have just tried to address as much as we can, as Joe mentioned, together. There's guidance on our website, on the CDC's website, and we have done several webinars, and you can find access to those on the CMAC website as well.
Thank you so much, Christy and Joe. I also added the link here for one of the webinars we also conducted with our CMAC colleagues and others on reopening aquatic facilities due to COVID in the midst of COVID. So you are welcome to find the recording here as well. And we will share the CMAC website for you on the chat as well, so you can access that too.
I want to, while we're talking about COVID, I want to take this opportunity. This is one of the ways that CMAC is working for the industry. And full disclosure, I have no idea what's going to come out of the conversation, right? But we have our state designee committee. The state designee committee are composed exclusively of state health officials that have been selected to represent the MAC and CMAC and CDC, well, the MAC specifically, at the state level. So we're actually engaging that committee on the 27th and our indoor air quality ad hoc group to discuss COVID-19 and indoor air once we get into the fall and winter months as more people move indoors in aquatic venues. So we're really excited about that. We don't quite know where it's going to go, but we're hoping that out of that we can have some actionable guidance based off experts and best practices that we can provide to the industry. It may not happen, but we're having the discussion.
Thank you. We do have another comment from Colleen. Thank you, Colleen. Yes, please continue to monitor CDC, CMAC, and NATURE's website, and we'll make sure to any changes or updates will be there for you as well. And I know there's a lot of information on the CMAQ website as well related to COVID.
Yeah, the good thing, Colleen, too, about the MAHC guidance and best practices through the aquatics industry when it comes to maintaining your water chemistry and your disinfectant levels, it's already a good fit for COVID, and it's already designed to kill pathogens, bacteria, and viruses, including COVID-19. And the water itself in the aquatic venues really hasn't been the concern for transmission of COVID. It's your proximity to others. And that's where some of the specialized guidance that come into play. But as far as your water goes, as long as you're maintaining your pool the way you always have, you should be in pretty good shape.
Thank you, Joe. So we'll give another minute here or two to see if there are any other questions submitted via our Q&A. Okay, so we have one question coming in here from Nathaniel. Any guidance on university indoor pool opening next week?
Nathan, on the
Daniel,
CDC website, go ahead, Joe.
Yeah, I was going to say, I'm assuming that your question is related to COVID. Nathaniel? Yeah, I kind of figured. Go ahead, Dewey. Take her away.
Yep. No, I was just going to mention that on the CDC website, we have CDC's created guidelines for and considerations for operating pools during COVID. So check out the Healthy Swimming website for that, and you should be able to see links to that. And Joe can also provide that as well, more specific link. You know, I do want to say that, just reiterating what Joe said, you know, the biggest thing we have as pool operators for operating our facilities is going to be proper sanitation of the water, proper filtration, and then also making sure that we're cleaning and sanitizing high-touch surfaces on a regular basis. You know, that's the biggest thing. The rest of it is look at what your local guidance says on social distancing and your building capacities. You know, that's the other key thing to this. As an operator, and I think I can echo this for all other operators, we do see kind of a general reduced bather load. In some cases, those are individuals that are concerned about COVID exposures. Other cases, it's capacity limits, right? So just check that out on cdc.gov and make sure you're taking into account those considerations and those guidelines when you're operating and opening your pools. I also want to point out that on our CDC web, our CMAQ rather, cmac.org, you can also find a webinar that we hosted in conjunction with CDC back in spring, May I believe, where we discussed COVID-19, and aquatic operations as well. So that would also be another good resource.
Thank you, Dewey. There's a question here from Matthew. Is it possible to share resources or information sources pertaining to the potential cyanic acid change that you mentioned in your presentation?
The best thing to do would be go to cmac.org. And then when you're looking at cmac.org, you will see a blue box kind of the center of the page where it talks about updates from the TRC proceedings. Click in, you can find the summaries there, you can find the recordings there. And then also you can find under Vote on the Code Triennial Conference, when you go to the individual CRs, you can do a keyword search for cyanuric acid. And you can also see those CRs, and you'll see the actual change request itself, and you'll also see the cyanuric acid or the technical review committee evaluations for that as well. So those are the best places to go and see that information. Some of that is still coming in, so it may not be 100% up on the website yet. But it should be there, by Monday. I will say that the discussion around cyanuric acid in isocyanurates and pools is very lengthy and very detailed. So make sure that you read, all the comments, all of the supporting information in those CRs.
Well, thank you all our panelists. And again, feel free to send any last questions via our Q&A box. Just say that we added a few links and resources to you here in our chat, and we'll also include these links in our follow-up email with the recording link. Again, we encourage you to visit NATIO's MAC Network website and also CDC's in the CMAC website. There's a lot of great information there. We heard about the Vote on the Code conference from Christy, so take advantage of the great opportunity to join in. You can find more information about that on the CMAC website, and also the virtual World Aquatic Health Conference. We're putting the link here for you as well if you want to register, and you find out more information there too. So with that, and I don't see any other questions, again, please feel free to reach out to us if there's anything else. If you have any questions, we really thank you for attending today's webinar. The recording will be available in the upcoming days, and we'll share that with you. And I want to say a big thank you for our panelists for joining us today. And I hope everyone has a great rest of your week.
Thank you for having us.
Thank you, Daisy. Thank you, everyone.
Thank you, everybody. Bye.